Hey everyone, Dr. Chu here with 360 Pain Academy, and today I want to talk to you guys a little bit about facet joint syndrome. Facet joints are an extremely common source of spine pain, yet most people have never actually heard of these joints. The mainstream media talk about sciatica and disc pain all the time. However, they rarely mention facet joint pain. As a result, many of my patients are really surprised and a little confused when I diagnose facet joints as the source of their pain. They'll ask, "You mean my pain isn't coming from my discs?" Though many people suffer from disc pain and pinched nerves, these aren't the only structures of the spine that can cause problems. I go on to explain that facet joint pain is actually the second most common issue I see in my practice. Officially, it's actually estimated that 15 to 45% of all back pain originates from the facet joints. This means that right now, at this moment, there are millions of Americans who suffer from facet joint syndrome. Thus, in a lot of ways, the facet joints are probably the most commonly overlooked source of low back and neck pain. In this video, I'll teach you everything you need to know about your facet joints and why they can hurt. To start, let's take a closer look at the structure of the joints themselves. The facet joints are located throughout the neck, upper back, and lower back. Many professionals actually refer to them as zygapophyseal joints, or Z joints for short. They exist in pairs, that means one on each side, at every single level of the spine. These joints are located in the back of the spine, behind both the vertebrae and the discs. From a more technical standpoint, the facet joints are considered part of the posterior column of the spine. This means they are a key part of the rear support structure of the spine. The facet joints are considered synovial joints, which makes them very similar to the joints of your knuckles and your knees. This means they are surrounded by a fibrous capsule on the outside and also lined with cartilage on the inside. This also means they are filled with synovial fluid, which serves as a natural lubricant. The facet joints are classified as plane joints, which means that the two cartilage surfaces are flat and slide over one another. This unique shape is how the facet joints actually got their name. Sensations and pain signals from the joints are carried by small nerves known as the medial branch nerves. These nerves are very fine, the size of floss, and branch off from the main spinal nerve to wrap around the facet joints. The medial branch nerves are very important because they are often targeted by physicians with both nerve blocks and radiofrequency ablation procedures. The facet joints are surrounded by multiple layers of important muscles, both small and large. These muscles help to stabilize and protect these joints as well as the rest of the spine. Now, the facet joints actually have several unique and important functions. First, they help to absorb loading. They also help to stabilize the spine while bending. They also help to limit the rotation of the spine. These facet joints work very closely together with the discs in the front of the spine. The discs are the flexible cartilage pads in between the vertebrae. At every level of the spine, there is a disc in the front as well as two facet joints in the back. These three joints together form what's called a motion segment. The motion segment is the fundamental functional unit of the spine. The facet joints and the disc work together all through the day to support the tremendous amounts of stress and loading and are what allow you to bend and rotate in so many different ways. As you can see, the facet joints are absolutely key and have a multitude of important jobs and often take quite a bit of abuse as you go through your daily activities. Unfortunately, this is why the facet joints are a very common source of pain in the neck and the low back. Several types of injuries and abnormalities can occur with facet joints. Degenerative and arthritic changes of the facet joints are definitely the most common I see in my office. Dislocation and fracture can also occur at these joints, causing a great deal of pain. Additionally, it's also important to keep in mind that the discs in the facet joints work very closely together. Hence, problems with the facet joints tend to affect the discs and vice versa. This is why degeneration is often seen in all three joints at the same time, and it's very common for doctors to diagnose both disc and facet issues simultaneously. Arthritis and degeneration of the facet joints is the next topic I want to talk about, since this is the most common cause of facet pain. Over time, after years and years of various stresses on these joints, they will often begin to wear out. Your doctor may be able to see these changes on x-rays and MRI and will often refer to them as arthritic or osteoarthritic changes. Let's take a step closer and see what this really means. As the facet joints age and degenerate, a number of changes can take place. First, the cartilage inside the joint can begin to thin and erode. Microscopic fissuring and flaking can often take place. The capsule around the joint becomes thicker and more fibrous. The joint can also become more swollen and surrounded by increased blood vessels. the bone of the facet joint can also thicken, deform, and also develop cysts and spurs. All of these changes can sound somewhat scary and actually make many of my patients very nervous, but it's very important to keep in mind that degenerative changes of the facet joints are exceedingly common, and degeneration does not directly correlate with pain. In fact, it's actually been shown that over 60% of adults over the age of 65 have some arthritic changes of the neck, and nearly 90% of adults over the age of 65 have arthritic changes of the facet joints in the low back. As I often tell my patients, no human being on planet Earth can really escape developing some degree of degeneration of the spine if they live long enough. Of course, arthritic facet joints are more prone to developing painful inflammation compared to young and healthy facet joints. However, it's important to keep in mind that there are many people who live pain-free in spite of having facet joint arthritis. Furthermore, pain flare-ups due to facet arthritis are actually very treatable. Later in the video, I'm going to go into some further depth into exercise and lifestyle changes you can do to actively manage your facet issues. I'm also going to delve further into interventional treatments that can be used for flare-ups of facet joint pain. But before I do that, let's go a little bit into how facet joint pain actually presents. People with facet joint pain often have well-localized pain either in the neck or the low back. Now, cervical or neck facet pain can radiate into the shoulders and the back of the head, often triggering headaches. Additionally, it can also cause aching and soreness of the area right between the shoulder blades, very, very commonly. Lumbar or low back facet pain can commonly radiate into the buttocks and the thighs. Once in a while, it can actually radiate as far as the calves, though this is actually pretty rare. In general, facet pain tends to worsen with both back bending, which is called extension, and rotation. It also tends to improve slightly with forward flexion. Now, my patients typically describe the pain as dull and aching in character. It can sometimes be sharp and is very often associated with muscle spasms. Often the facet joints will be tender when I palpate them. Lastly, facet joint pain tends to worsen with standing and walking for long periods of time and tends to improve with sitting as well. Next, let's go a little bit into the treatments for facet joint pain. There are several very effective interventional procedures that exist for this condition. In fact, facet joint procedures are some of my favorite to do since they tend to work very well in patients who are accurately diagnosed. Now, the first thing I want to talk about is facet joint injections. With this procedure, your doctor will actually directly inject your painful facet joints with the help of X-ray guidance. During the procedure, your physician will actually introduce a mixture of steroid and numbing medication directly into the joint itself. The goal of this procedure is to actually decrease the inflammation of the joint, quelling the flare-up for a few months. This gives you a great opportunity to rebuild your strength and mobility in a physical therapy program and a home exercise program as well. The next thing I want to talk about is a procedure called medial branch blocks. This is really more of a diagnostic tool than an actual treatment. With this, the physician actually targets the medial branch nerves that carry pain signals from the facet joints. With the help of X-ray guidance, your doctor will use needles to inject a numbing medication over these medial branch nerves. This numbs the facet joints for several hours. Now, if your pain is significantly improved during this period, then your physician has confirmed the diagnosis of facet joint pain. You can then move on to having a radiofrequency ablation for much longer-term pain relief. Now, let's talk a little bit about this radiofrequency ablation. Now, if you had good relief with your medial branch block, then you've confirmed that the facet joints are in fact the source of your pain. You can move on to this radiofrequency ablation procedure, which provides a much longer duration of relief. With this procedure, your physician will direct special needles into place directly over the medial branch nerves. After doing some stimulation testing for safety, each area is numbed with medication. Next, the tip of each needle is heated up a little bit, creating a small burn over the medial branch nerves. Afterwards, the medial branch nerves can no longer carry pain signals, blocking the facet joint pain for a long period of time, often up to about 9 to 12 months. Personally, the RFA is one of my favorite procedures to do because it has a lot of strong scientific evidence supporting it, and it actually just works really well in the properly selected patients. Furthermore, let's talk a little bit about exercise and lifestyle. As I discussed earlier, the facet joints are surrounded by lots of layers of muscle. There's small intrinsic muscles directly over the facet joints and also much larger erector spinae muscles on the outside. These muscles provide stability and protection for the facet joints. As they become stronger, they can actually decrease the wear and tear in the joints and actually slow down the degeneration of the joints. More importantly, this means less frequent and less intense flare-ups. This is why I emphasize the importance of physical therapy and developing a long-term home exercise program for every single one of my patients with facet pain, regardless of whether or not they are getting injections also. The core muscles serve as crucial scaffolding for the spine, and you need to develop these muscles so that your facet joints are supported and protected in the long term. Oftentimes, when the joints are very acutely inflamed and the pain is very severe, it can be difficult to participate in physical therapy or even do your home exercise program. This is why, in my opinion, it's best to initially to control acute facet pain with an intervention like a facet injection or maybe a radiofrequency ablation, and then follow it with physical therapy and a consistent home exercise program. Injections are a huge part of my practice and can definitely be very helpful. However, in the long term, there's definitely no substitute for hard work on your part. Lastly, I also want to mention a few other factors that can be very important. It's been shown that age, sex, weight are all very important factors that affect facet pain. Obviously, you can't change your age or your gender. However, you do have tremendous control over your weight. It has been shown that higher levels of obesity correlate with worsened severity of facet pain and facet arthritis, as well as just back pain in general. Hence, putting in the effort to lose weight is not only great for preventing heart disease and diabetes, it can actually also help to prevent back pain flare-ups. Many of my patients have noticed significant improvements in their facet joint pain from losing as little as 10 pounds. Now, I know that losing weight is far easier said than done. The majority of my patients struggle with it, and I have yet to hear a single patient tell me that it was an easy journey. It takes tremendous willpower and discipline. However, the myriad of health benefits of getting to a healthy weight, especially with regards to spine health, make it so worthwhile to invest consistent effort into nutrition and exercise. That's it for this video. I hope you found it helpful. Thank you so much for watching. If you enjoyed the video and found it helpful and informational, make sure to hit like and subscribe, and also visit our website at 360 Pain Academy. Thanks again for watching. Until next time.